So I'm Vin Petrini. I'm the Senior Vice President of Yale-New Haven Health up in New Haven, Connecticut. And I think that one of the fundamental things that are challenging our industry right now is just how to manage change. And I'm not talking about the typical everyday change that we see and are so accustomed to, but I'm talking about the significant rapid evolutionary change that we're really kind of feeling throughout the environment, and that cuts across all industries, it cuts across all sectors. As communication executives, I think it's incumbent upon us to really try to figure out how do we manage this to the best of our ability. And I think in large measure it's a byproduct of technological advancements, social media, the way we communicate it I think has fundamentally shifted and changed in a big way, and how you connect and how you build relationships with your audience is the critical people that are so important to your organization really is of the fundamental importance as we move forward. So some of the things that we've tried to think through, and I've had the benefit of working for nearly 2 decades in the healthcare industry, which I think by and large is one of those sectors that has changed more than most. But we've really tried to evolve our thinking about how we build those relationships with our key constituents, our patients, their families, the communities that we serve, and how do we build that narrative in a way that they can take what are extraordinarily complex ideas and boil them down in simple ways that not only they understand, but can embrace on our behalf as well. I think that's become more and more of a challenge as you've seen the growth of third-party sites, blogs, microsites, social media, Facebook, where information that before was filtered through media outlets is now unfiltered. So information that is not necessarily reliable, information that's thrown out there, rumors, innuendo, can really begin to impact the reputation of your organization. So you really have to be on top of it and truly understand that. What we've done at Yale-New Haven is we've really tried to adopt a perspective of optimism. In healthcare, as you know, especially in the last 2 to 3 years, the changes have been really seismic in nature. We're living in a post-healthcare reform era. The way that we deliver care, the way patients are seeking care has fundamentally shifted. And in the old days, hospitals would have a relationship with a patient that would literally last the 3, 4, maybe 5 days that they were in the hospital for either a surgery or addressing a medical condition. And in essence, the relationship would end pretty much as they were discharged back to their home and to their community. As we've moved from that model of care, from that episodic care, to really just being accountable for the care before the individual arrives at our front door, and then well after they're discharged in the community, we've got to think differently about how we build those relationships. And that's literally, for us, hundreds of thousands of lives every year. So we've looked at it from the perspective of optimism, that we, in an era of great uncertainty and great anxiety, especially in an industry as complex as healthcare, we want to be that credible source to provide some authenticity, to provide information that's reliable for the patients that we serve. To do that, we've got to maximize the way we communicate with those individuals. We have to listen more carefully to their concerns, their ideas, their concepts, and really put those into practice, engaging through social media, engaging through patient forums, and really beginning to think about how we transform their lives. In essence, you know, health is the one thing that enables all other aspects of people's lives. The one thing that we've understood from our patients is they assume that we've got the technology and the expertise, but what they really want to know from us is, are they going to be able to attend their daughter's wedding? Are they going to be able to be there for their grandson's birthday party? And they want a relationship with an organization that's not going to give them just hope. They want someone who's going to give them the best opportunity to get back to their lives. And that's really the essence of where we've decided to work from a communication platform to develop that narrative and to say that collectively together we will work with you to get your best outcome possible. I think that in essence that kind of symbolizes where we are from a communication perspective. You have to think out of the box innovatively about how you communicate. There's a wide range of audiences. Issues are extraordinarily complex. You need to be prepared to battle back the rumor and the innuendo, but you also need to be able to affirmatively state what you believe in and what you stand for. And if you can do that in a pretty cluttered environment, I think you can be reasonably successful.